you are more aware of it, or it's on your radar. So in the kidney disease outcomes quality initiative, it's KDOQI, which is put out by the Kidney Foundation. There's practice guidelines, and we do have a cardiovascular disease practice guideline in which, this is for dialysis, this is not for transplant, all dialysis patients should be counseled and regularly encouraged by nephrology and dialysis staff to increase their levels of physical activity. We do need a similar practice guideline for post-transplant care. In the new, I think there are new guidelines for transplant care in the United States that state that lifestyle intervention should be encouraged, but that's basically all it says. Doesn't say anything specific. So then there's reasons for encouraging and recommending physical activity following transplant. There's data that shows physical functioning is improved and optimized. They present for transplant with low levels of functioning. They present for transplant physically inactive. And there's a high prevalence cardiovascular risk factors. May attenuate weight gain, will definitely optimize functioning, and will have a positive impact on quality of life. Question is whether regular physical activity improves transplant outcomes. We have absolutely no idea. There's really not been any studies to look at that. In the States, basically that's what we need, but transplant outcomes are pretty good in terms of death. But the other things are what we get with regular physical activity, quality of life, and improved functioning. Reasons for, basically, patients are afraid to exert themselves. After transplant, they don't know what to do. They've had a transplant, they don't want to do anything to hurt that transplant. Their patient families are very protective of them. They need counseling. And the best time to do it is immediately after transplant, when they're making changes and they're going to go home with it. They are too weak, low functioning. They need appropriate prescription for type, progression, and exercise. And why would exercise be good? It makes me tired. If they progress gradually, it'll give them more energy. They need regular encouragement, as we all do. And then if we start right at transplant, perhaps we'll have a better chance of it becoming a part of their overall positive lifestyle and an expectation after transplant. So it'll provide an added level of medical surveillance, and I just think that we need to change some attitudes. In transplant patients, dialysis, I made this slide basically for dialysis, but I think it happens with everything. We have group patients who have very low functioning, and what happens is they and their family expect, oh, I have this disease, I've had a transplant, I guess I'm supposed to be low functioning, not supposed to be able to do the things I always did. They adapt to that low functioning, they get other people to do things, they change their job, they stop their job, whatever, and they accept it. And this is the tragic part of it. They accept it, and this is the way it is. I have kidney disease, this is the way it is, and the staff who are around them, in the dialysis unit particularly, they accept that they are low functioning, and it feeds back on each other. If a patient comes into dialysis and they say, oh, I used to play tennis, can I play tennis again? Well, if the staff expects them to be low functioning, then they're going to tell them probably not, right? Same thing after transplant. I've had a transplant, what can I do? Where are they going to go? They're going to ask the staff, not their neighbor. So what we have to do is, what this all ends up with is there's a lack of assessment of physical functioning and lack of interventions. So I would like to propose that symposiums like this and mechanisms to incorporate exercise counseling into the routine practice will reverse some of this and make it so we don't start with low patient functioning. And this is a video from our transplant games, but I'm not going to show you because I don't have the same folder, so I forgot. The video don't get in, but I'd be happy to answer any questions.